Bismillah ar-Rahman ar-Rahim. Our case today is very interesting. This baby is early term, 38 weeks, spontaneous vaginal delivery. Baby delivered flat, apneic, cyanosed. Resuscitation started. Initial steps, positive pressure ventilation. Then the baby is require intubation, chest compression. Even he reached to the medication level. The impression at the time the baby is early term, 38 weeks, RDS to rule out early neonatal sepsis, most probably congenital diaphragmatic hernia because the baby is not responding to the resuscitations. So chest X-ray was done. This is the X-ray white out lung. So our concern actually, or the message from this case, what is the common causes of white out lung in the neonate. Actually مجموعة في كلمة Donald Trump. D, this means diaphragmatic hernia. T stand for total anopulmonary venous drainage or TTN. R, RDS, respiratory distress syndrome. U, uniformal or unique aspiration pneumonia. M, meconium aspiration. P, pulmonary hypoplasia pneumonia, pulmonary edema, and pleural effusion. So this is the most common causes of white out lung in neonate. Donald Trump. D, diaphragmatic hernia. T, TTN, total anopulmonary venous drainage. R, RDS. A or U, uniformal or unique aspiration pneumonia. M, meconium aspiration. B, pulmonary hypoplasia pneumonia, pulmonary edema, pleural effusion. This is the cause. How to differentiate between these all causes? By stepwise. The first step, look for the lung volume. If lung volume is decreased, this means RDS or lung hypoplasia. If lung volume is normal or high, this means TTN, pneumonia or meconium aspiration. The second differential point, look for the mediastinal. If mediastinal shifted to the same side, this is collapse. If shifted to other side or displaced to other side or opposite side, this is congenital diaphragmatic hernia or pleural effusion. This means hydrops or edema. The other differential point, the actually corresponding or gestational age. For example, the baby premature, I will think RDS. Baby term, I will think pneumonia or TTN. If post-dated, I will think about meconium. Then I will look for the history. I have to take history to differentiate between all of them. For example, this premature babies, and this is X-ray, so this is RDS. So it will be air bronchogram and diffuse granular opacities. And also if the baby having meconium, for example, I will think about it's due to meconium. If the baby full term and after 4 hours and cesarean and there is fissure in the X-ray or increased bronchoscopy marking and hyperinflation, I will think about TTN or transient pneumonia of the newborn. If the baby have sign of sepsis and bilateral infiltration, this is pneumonia. If there is pleural effusion and actually obliteration of the costophrenic angle, so I will think about hydrops and edema. If there is hydrops and edema, I will think this is pleural effusion. I have to tap the chest to clear the effusion. If there is scaphoid abdomen and X-ray, there is the bowel in the chest and decrease air entry, and I cannot, and the heart or the heart sound is in the other side. So you think about congenital diaphragmatic hernia. But unfortunately, this baby actually having during the intubation, it goes to the focal cord, but actually the tube is not goes actually beyond the trachea. If you see, even the ATT is very high here. So this is initially we suspect congenital diaphragmatic hernia, but later on we suspect this is tracheal atresia, call it congenital high airway obstruction syndrome, congenital tracheal atresia. We consulted the ENT and for tracheostomy, but unfortunately the lesion is distal to the trachea, so the tracheostomy it will not get any benefit for this baby. Even if you will put laryngeal mask, it will not get any benefit for such cases. So our message from the case, what is the common causes of white out lung in the neonate? Donald Trump. D, diaphragmatic hernia. T, TTN. R, RDS. uniformal or unique aspiration pneumonia, meconium aspiration M. The B, the pulmonary hypoplasia, pleural effusion and pulmonary edema or pneumonia. How to differentiate between all of them? Look for the lung volume, if small RDS and hypoplasia, lung hypoplasia, if normal or high TTN or pneumonia or meconium aspirations. Look for the mediastinal shifted in same side, this is collapse. If shifted to other side or opposite side, this is congenital diaphragmatic hernia or pleural effusion. You have to do tapping. And also look for the gestation age, baby preterm, RDS, term, this pneumonia or TTN, post-dated, this is meconium. And look for the history, birth history. For example, this baby preterm, so it will be RDS. If there is meconium, this is baby goes with meconium. Look, if the baby having a cesarean and the respiratory stress develop after 4 hours, and there is fissure in the X-ray, increased bronchoscopal marking, hyperinflation, this is TTN. If there is sign of sepsis, this is pneumonia. If there is history of hydrops, edema, this is pleural effusion. If there is scaphoid abdomen and the heart sound, I cannot hear, it will be in the other side, or there is mediastinal shift, think about congenital diaphragmatic hernia. So our case, this is tracheal atresia, call it congenital high airway obstruction syndrome. ومن أحياها فكأنما أحيا الناس جميعا. شكرا، سلام عليكم.